Hi viewers, welcome back. In today's video, we are going to discuss about an interesting topic, polycystic ovarian syndrome. It is a syndrome characterized by amenorrhea, hirsutism and obesity associated with enlarged polycystic ovaries, a heterogeneous disorder characterized by excess androgen production that interferes with the reproductive, endocrine, and the metabolic function. It was first explained by Stein and Levinthal in 1935. It is also called as Hayr-Ann syndrome. It is the most common endocrinal disorder affecting nearly 5 to 10% of the women who belong to the reproductive age group of 15 to 45 years. The incidence increases with change in lifestyle. It is nearly 20%, causing infertility in females, and is also strongly associated with insulin resistance, which can cause diabetes, cardiovascular diseases, and hypertension. The cause is not clearly known, but it may be due to a change in the lifestyle, diet, and stress. There can be genetic factors, that is CYP21 gene mutation, and sometimes it runs in families, that is hereditary, and obesity causes insulin resistance and hyperinsulinemia, which can cause PCOS. Rotterdam criteria is the criteria that is used in the diagnosis of polycystic ovarian syndrome. If 2 out of 3 of the following characters are present, then you diagnose as PCOS. Polycystic ovaries, 12 or more peripheral follicles with 2 to 9 mm in diameter, or increased ovarian volume which is more than 10 cubic centimeter. There can be oliguria or anovulation, and there can also be signs of hyperandrogenism. So, from the above mentioned criteria, at least you must present with 2 to 3 of the criteria to confirm your diagnosis of polycystic ovarian syndrome. The symptoms of ovulatory dysfunction includes amenorrhea or oligomenorrhea, which is 87%, irregular uterine bleeding, which accounts for 26%, and infertility in 20% of females. The other symptoms of excess androgen include hirsutism, acne, alopecia, or baldness. Hirsutism is also a symptom of increased androgen level, in which the luteinizing hormone stimulation of the theca cells and decreased HSBG from the liver is found. Free testosterone increases the causes for hirsutism. The symptoms of insulin resistance include acanthosis nigricans, that is, dark colored patches over the neck, shoulders, armpits, etc., and obesity in the female clients. There can also be enlarged ovaries, where multiple peripheral cystic follicles fails to mature and apoptosis ceases due to the increased androgen levels. Premature follicles, atresia, despite follicle stimulation from a steady state of follicle stimulating hormones. The long-term risks include diabetes, hypertension, hyperlipidemia, cardiovascular diseases, endometrial cancer, breast cancer, recurrent pregnancy losses, and ovarian failure. The confirmation of the diagnosis is done with medical history, including your menstrual history, weight gain, and other related symptoms. Physical examination is also done for the confirmation and assessment of the blood sugar levels, blood pressure levels, weight gain, hip waist ratio, and also for the signs and symptoms of hirsutism. Pelvic examinations are done to rule out the enlarged and the swollen ovaries and the number of small cysts. Blood investigations to rule out the blood sugar levels and the hormonal levels, especially the androgens. Sonographies are done to examine the patient for the cysts in the ovaries and also to see the thickness of the endometrium, which is going to be increased in case of irregular periods. Finally, we come to the management of PCOS. Here, the treatment is based on the symptoms according to the need of the conception to prevent the disorders as diabetes and cardiovascular diseases, and also many a time all these needs are to be managed simultaneously. The approaches include your pharmacological management, non-pharmacological management, and surgical modifications. The aim of the pharmacological management is to maintain regular menstrual cycle. So usually they are started with oral combined pills, oral contraceptives and cyproterone acetate, oral contraceptives and spironolactone, ketoconazole 200 mg daily reduces the testosterone levels. Estrogen is also started to suppress the androgens and the adrenal hormones. It raises the secretions of the sex hormone binding globulin in the liver and decreases the free testosterone levels by binding with the testosterone. It reduces the secretion of luteinizing hormones and is usually given as a low dose combined pill having less androgenic effect. If the client presents with hirsutism, acne can be managed by using 1% clindamycin lotion or 2% erythromycin gel in case of pustules. Antiandrogens with cryptoterone, spironolactone, and furosemide can be administered. Dexamethasone 0.5 mg at night can reduce hirsutism. If there is complaints of infertility, clomiphene citrate is the first line of treatment for infertility. Partial estrogen agonist can be started. It induces the gonadotropin releasing hormone secretion in women by blocking the estrogenic feedback of the pituitary gland. The amount of the luteinizing hormone and the follicle stimulating hormone secreted also increases, which improves the ovulation if the ovaries are responding to the gonadotropin. It can be started at any time if the woman is having amenorrhea. In normal cycles, it is started on day 2 for 5 days. Metformin is also used to treat the causative factor as endocrinal and metabolic dysfunctions improves the fertility rate and thereby called as insulin sensitizers. The surgical management is indicated in case if the woman is having infertility, if there is a failure of medical management, when there is hyperstimulation of the ovaries, if there is a previous pregnancy loss. Surgical corrections include puncturing of the cyst by laparoscopic method of drilling or by unipolar electrocautery. Surgical corrections also help in restoration of the endocrinal functions to improve the fertility rate, and the complications of the treatment include pelvic adhesions, which may again lead to infertility. Hope this video was informative and interesting. Thanks for watching and subscribe for more videos.